go.
Yes, hi, I'm Dr. Tensu again with Texas Spine and Sports Therapy. I'm here with Brittany. We're going to demonstrate how we use this, what's called the ATM2, or Active Therapeutic Movement. This device is really an interesting device in how it can produce fairly immediate results. It's kind of modeled after the research done by Brian Mulligan, which is a pretty famous physical therapist. We're going to pretend Brittany has some sort of movement disorder. In this case, we're going to say that Brittany has problems in extension of her lumbar spine. So we're going to test this, and we're going to have Brittany go back and stop at the point of pain. She's having pain about right there. And so this therapy is used when the patient has difficulties moving the shoulder, the neck, the hips, the lumbar spine. Any region that hurts to move can actually be rehabilitated on this. Again, the principle of this, and we're going to demonstrate, if you want to come over here and stand against the platform, go ahead, put your arms above and scoot right up in. But we use a series of belts to protect the region. And so really you're doing neuromuscular training. The brain, when there's regions of pain, seems to lock everything in and sets a very high muscle tone. As you use different belts, which we're going to start to apply, and you start to tighten the belts, you've given the brain a sense of stability. And so as you start to say, hey, this area is protected, and you decrease the pain with movement, and then you retrain that movement when it's painless, it actually works really well. Or the brain gets the understanding that it's okay to move that direction, the muscle tone decreases, and the range of motion can be almost immediate. So I'm going to start by just applying a couple belts. We apply them to the lower pelvis in this case, and everything that we're doing here should be completely painless. And we're going to keep asking Brittany, is that too tight? You can handle just a little more tightness. Okay, so we tighten this up until it starts to decrease, and then we test the motion. So the whole goal on this is to get her so she has pain-free movement. We'll test her, we'll have her move again, and again, if she had pain, she'd probably say at that point, I still have some pain. In that case, we would go on to the next belt, we tighten it in, we lock down that lumbar segment, and we go ahead and we tighten this until it's nice and secure. And when we do that all the way up until we have no pain. So I know the belts aren't very tight. In this case, we can have Brittany pretend she's going to go back and say, okay, you know what, right now I have enough support that there is no pain associated with this movement. At that point, we're going to do isometric contractions. I'm going to put this under, and this belt is going to be a resistance device into the machine. We apply that, and in this case, I'm going to have you go ahead and just lean against the device, count 4 seconds, hold that, and we're going to have her do this 10 times. And what's happening here is the back is protected, the muscle activity has been decreased, the brain is going, and this no longer hurts to move this way, and we're training that movement. So the whole goal, again, there should be nothing painful in this case, and so nothing hurt. And if there was any pain, we would lock it up a little bit more. I'm going to go ahead and remove it, assuming that she finished her therapy, which again, this is just for demonstration purposes. We're going to take those off. And then, again, as these are taken off, be careful when you step back, come on off, we'll usually do an immediate test. And the neat part about this device is if we've trained it right in a pain-free way, we can get the patient off and have her bend backwards. We'll almost always know if this therapy is going to be appropriate, if it's going to work, which we usually see a significant change. The patient usually says, I can bend a little bit further, this is downgraded, the muscles are not as tight, and it's been a very effective, very quick device to help with pain. Thanks.